Today, we're going to shine a light on survivorship in breast cancer. Breast cancer is a scary word that no one wants to hear from their physician. When you're diagnosed with breast cancer, your mind can often go to, how long am I going to live? But because treatments have improved over the years, survivorship in breast cancer, I find, is a word that I'm hearing more often now in breast cancer communities, online, and in the media. So I really contend it's how we live our life that can impact the value and meaning of survivorship. So I invited a person who not only knows firsthand about being a survivor, but speaks to breast cancer patients, survivors, in her professional life as a breast cancer surgeon. My guest today is Dr. Deepa Halaharvi. She completed her residency in general surgery at OhioHealth Doctors Hospital and completed a fellowship in breast surgical oncology at OhioHealth Grant Medical Center. She's a breast surgeon and a breast cancer survivor at OhioHealth in Columbus, Ohio. And as a podcaster, I enjoy listening to other podcasts myself to learn from their content. Dr. Halaharvi is the host of the Breast Cancer Podcast, along with another survivor, Monica Brooks. So I'll put the link to this information and other information that we talk about today in the show notes. So Dr. Halaharvi, you've been in my private Facebook group a long time, and this interview is overdue. In fact, I think it was one of your patients that nudged me and said, you need to interview Dr. Halaharvi for a podcast. So here we are. Thanks for...
Oh, thank you so much, Terry. Thank you for having me today. I really appreciate it. And yes, and we've been in touch. I want to say, so I was diagnosed about 8 years ago.
Mhm.
I want to say it was pretty soon right after that. And you had asked me if I was going to a certain conference. I can't remember which one now. And I think I was like just then diagnosed, and I wasn't able to make it to the conference. I did go to ASBS 2 weeks after my bilateral mastectomy, which was something I probably should not have done in the hindsight. But as surgeons,
Oh.
we're crazy. So
You
yeah.
know, that's really interesting because I didn't go to ASBRS this year because, being in Seattle and then it being in Boston, it's just, I had already gone to a conference in Miami in January and I couldn't wrap my mind around that cross-continental, trip again. But, I do remember Dr. Halaharvi. This really impressed me last year in Las Vegas, that there were other breast surgeons who had formed a group, a community of breast cancer surgeon survivors. And they met at that meeting. It just gave me goosebumps because my own breast surgeon is in that group.
Oh, is that right? Oh,
Yes.
wow.
Yes. So I feel like that community spirit is really important. I mean, not just for you and your, breast surgeon colleagues, but just in the breast cancer community in general. So, well,
Yes. Yes.
how about since we're going to shine a light on survivorship today, why don't you start by telling us your breast cancer story? We have some things in common.
Okay. All right. So yes, so I was migrated to the United States when I was 16 with my parents, and always wanted to be a doctor since age 5. Finished undergrad, getting ready to apply to medical school. My dad had a stroke, so I took some time off from school and took care of him for a few years. My mom was working to keep his insurance, so he had a hemorrhagic stroke from a meningioma. So
Mm.
he was in a coma. And so he was actually quadriplegic for 16 years. So I took care of him like all the time, 24/7 for the first 3 to 4 years. Then I enrolled in a local physician assistant school. This is in Wichita, Kansas. Went to the physician assistant school, was a PA for about a year, but then this nudge of wanting to be a doctor kept coming back at me. And so I did apply to medical school. After I talked with my husband, I said, okay, I have to give up my the income I was getting as a PA and take loans to go to medical school. And he's like, well, do it now or never, And so I was in my mid to late 20s. And so I applied and I got into medical school, and 10 years of journey, and finished medical school and wanted to be a trauma surgeon. So came to Columbus, Ohio. They
Mhm.
have really good program in trauma surgery, part of the fellowship. And so in my general surgery residency, I met a young lady who had stage 4 breast cancer, my age, my kid, she had kids, my kids' age. So we kind of connected, and she said, oh, you really need to be a breast surgeon. You're very good with the relationship building. And I like the research aspect of breast. And so I applied, I got into breast oncology, didn't really think too much about it other than the fact that I liked relationship building, the research aspect, and just helping a patient from diagnosis to survivorship. And my father passed away 4 months after I started working as a breast surgeon. As an immigrant parents, they always tell you, whatever you do, be great at it. Whatever job you do, if you're cleaning bathrooms, be great at it. So that was his message to all of us kids. Mediocrity was not an option for us. And so my prayer was, how could I be the best breast surgeon? And so I always say the answer came in form of my own diagnosis of breast cancer 8 months after I started working as a breast surgeon. So at that time, it did not feel like a blessing or prayer, answered prayer. Of course, I went through
No.
all those emotions that anybody else goes through. I wasn't devoid of emotions just because I'm a breast surgeon and breast surgeon. I still had denial. The pathologist actually called me and said, oh, by the way, the biopsy results came back cancer. Of course, I remember asking him, are you sure you looked at my slides? And that's a common thing people
Oh, it
ask.
is.
And it's important for me as a physician then to know it's okay. Patients are in shock, denial. I've been through anger, bargaining, depression, and then finally acceptance. The whole thing took about a year.
Mm.
And I'm pretty active on social media and very much involved in my patients' lives because I want to help them to shorten that time of going through, denial through acceptance, because the longer you are in each phase, it takes forever to recover and to, not just do survivorship, but to find that new normal. And now my life is way better than it was ever before, ever. I live the most beautiful life, and by no means we are rich or anything like that, but it's just very meaningful, purposeful life that I live now. And I honestly don't think I would have had that had I not had breast cancer, diagnosis. So
Yeah, that lends a whole new element of empathy for you, doesn't it? But not
yes,
only that, Dr. Halaharvi, everything that you had been through, with your dad, with your parents, all of that, I think, prepared you,
yeah,
at least in my mind. Do you think that?
yeah. Oh yeah,
Yeah.
absolutely. Every event that was taking place was
Mhm.
preparing me. Between high school and undergrad, I went to LPN school, licensed practical nursing school, for 1 year because my parents, as new immigrants, they couldn't afford to send me to college. And so my dad said, you could work as an LPN and go to undergrad. So I did that. It turned out that as an LPN, I took care of stroke patients, not
Oh,
even knowing I would
wow.
take care of my dad in the future. Yeah, it's just everything works out. And when
Yeah.
we're going through it, you just don't understand why you're going through it. But there is if you think about it long enough, there was a reason why you went through it, but you don't know it in the midst of going through it. So
Yes.
absolutely every one of those things helped me to be who I am today. I wouldn't change any of it. I mean, unfortunately, I wish my dad didn't suffer as like he did, but
Right.
for me to be there to help him, to take care of him, it meant everything to me. So
Oh,
yeah.
yeah. Well, and that experience also helped in the caregiving setting because you do that
Yeah,
every day with your
right,
patients.
right,
You were in
right.
surgery today, you told me
Yes.
earlier.
Yeah. We did this Goldilocks mastectomy. This is something new we're performing here in Columbus. So yeah.
Well, do you just want to touch on that for a minute? I
Yeah.
have people ask me about that all the
Yeah.
time.
Yeah. So I perform Goldilocks mastectomies with my partner, Dr. Mark Kripe.
Mhm.
And it's this procedure for these women with large ptotic breasts, meaning large, us women, when we nurse our babies, our breasts tend to droop a little bit. But those women who are a little bit heavier on the BMI and have large breasts, they're not, usually candidates for reconstruction if their BMI is 38 or over. And so it's a great option for those patients, where we perform a mastectomy, remove the breast tissue, then we use the skin to form like a breast mound. So when they wake up, they look like they just had breast reduction, is kind of what they look like. But then they're having a mastectomy, removing their cancer. And we've been performing more and more. And I actually do that with my partner, who's a breast surgeon. And so we've been doing these ourselves over the last year or so, and we've performed quite a few of them. So
Okay. We just got an added bonus today with the Goldilocks mastectomy, because women ask about that. It's a term that's out there in the breast cancer world. They read about it or have heard that it might be a good option for them, and so they want to know more about it. Thank you so much for adding that. And I also have to tell you, Dr. Halaharvi, you said you were in Wichita for your PA training.
yeah.
That's where I was born and raised.
No way.
Yes way. Where did you go to school there?
In Wichita State. So that's where I had my undergrad, and then a couple of years later, I got my PA degree there. Yeah, my physician assistant.
That's where I graduated college, is, the Woo Shocks, the
Oh my,
Shockers.
yeah, Shockers. Oh my gosh, go Shockers. You just made
Go
my
Shock.
evening. Oh my gosh, no one even knows where Wichita is. This is crazy.
I
Oh, that's so
know.
awesome.
I know. I have goosebumps. That's so, when you said that and
Oh,
my eyes went like that.
yeah,
Yeah,
my mom still lives there.
that's why. Yeah,
Yes.
my mom and my sisters still live there. So a lot of my
Oh,
family.
oh,
Yes,
that's awesome. All
Kansas
world.
born and raised. Yes, exactly.
Oh, that's awesome.
Okay. We're newly diagnosed. We're talking about survivorship, which is kind of a spectrum. It's kind of a process. So we're newly diagnosed, Dr. Halaharvi. What would you tell your patients that they can gain control of? Because I think when we get newly diagnosed, we feel out of control. There's just that feeling of being out of control. But I contend there are things that we can control that kind of help us begin, oddly enough, that survivorship program, even at the beginning of diagnosis.
Yes. So patients, I mean, this is my everyday thing that I do. Patients come in, they're, they don't know. They really think they're dying. Anytime you hear the C word, cancer word, it's a scary word to hear.
Yeah.
So I first, what I do is I review their imaging, go through their pathology, explain everything. Knowledge is power. So that's the first thing is, making sure, and people do come to me after they've Googled their diagnosis and they're, freaking out. And I'm like, don't do that, and I do give them a couple of reputable websites like American Cancer Society or Breast Cancer 360. It's, with ASBRS and, NCCN guidelines. But I go through their diagnosis, their treatment plan, and I give them as much information as possible. And in fact, the breast cancer podcast, that's how it came about, is when I would see the patients and I would take about an hour explaining everything about their diagnosis and the treatment plan. And it's a shared decision making. So my job is to explain to them what their options are. We make the decision together. And, that's something, that's really important to me as a breast cancer surgeon and breast cancer survivor. And patients are, sometimes lost. And they can only remember 10% of what you tell them in the office. So that's where I made the podcast, so patients can go back to listen to that. And so, and what I say is, what are some things you can control? Number one, most of the time, early stage breast cancer has great prognosis.
Yes.
It's almost like a chronic disease anymore. Patients do really well as long as you're, going through the treatment plan of surgery, chemo, plus or minus radiation, and endocrine therapy, whatever your cancer, requires. And like with any kind of adversity we face, one thing we can always control is our attitude, right? Like, how are we going to deal with it? I do see women, and very often, like, what did I do? Did I take birth control? Did I take hormone replacement therapy? I didn't nurse my child. I didn't do this. I'm like, no, stop all that talk right now. Right now, all we can do is look to the future. what we didn't do or did do in the past, it doesn't matter. Breast cancer happens 1 in 8 women. I was that statistic, 1 in 8. I thought I was doing everything right. I had kids very young. I never smoked. I drank very rarely. I wasn't obese. So there are risk factors, but then it can happen to any one of us. I've seen vegans that come in with breast cancer diagnosis, runners, marathoners, training for all these big events. So, anyone can be diagnosed with it. So figuring out what the next steps are and finding your team that you feel the most comfortable. I do sometimes have patients that I bring them back the second time, or I talk to them over the phone a couple of times just to kind of explain to them what's going on. I think the most important thing is that they find a medical team that they trust and feel comfortable with, someone who's listening to them and giving them that sound scientific advice on their treatment plan. And again, you want to surround yourself with group of people that you trust, your family members and friends that will support you. But people, well-intentioned people will say, oh, when with my cancer diagnosis I did this, you should do this. Don't listen to all that. Every cancer is different and we can't do what other person is doing. So
Mhm.
finding that good medical team is really important. Your surgeon, your medical oncologist, your radiation oncologist, your plastic surgeon, you have to feel comfortable with that team. And attitude, there's so much that can be said about that, is we truly can control this attitude. And I tell women who have kids, your kids are watching you, so we have to show them how we deal with adversity. And
Mhm.
I've learned so much from my patients, so much kindness and grace and resilience, and I just think, my gosh, like, how do you do it? And they show me so much all the time. But um yeah, just finding that group of people that you feel comfortable with, this medical team, your team at home. I really don't believe you should go and announce it to the whole world that you just got diagnosed with cancer. Again, well-intentioned people will be giving you advice that you don't need, or so that kind of can become, and every time you're retelling the story, you're replaying it in your mind, and that can be also not very good for your brain and your mind. So
Yeah, you do have to take a break from it sometimes, and it's
yeah.
okay to do that. I like the word you used earlier, trust, in the setting of shared decision making, because that's what builds that trust. Um, I talk about shared decision making often in the setting of plastic surgery, but I really learned about it through my breast surgeon, because it was that conversation that I had with her where she was very respectful, listened to me, I listened to her, her expertise. I think that when you feel that trust, and that to me is a large part of survivorship, because that helps you move beyond the diagnosis and get that control, like you were talking about, Dr. Halaharvi, and begin to figure out next steps. And the trust is what builds that. So I'm really glad that you brought that term up. We do have something in common in that we both chose deep flap, and you did mention having a plastic surgeon as part of the team. So do you want to speak to us a little bit about what, in the setting of this conversation today, what did having deep flap breast reconstruction mean, and how did that weave into your personal survivorship after breast cancer?
So, I really wasn't planning on having a deep reconstruction, to be honest with you. I was 8 months into working as a breast surgeon in my new career. So I just wanted to, have surgery, go back to work. That was my mental plan, like, I'm going to have surgery, go back to work. Of course, we have our plans, and there's things that happen, right? So I did have a double mastectomy with reconstruction with tissue expanders. And like I was telling you earlier, I went to ASBRS conference with the drains still in place.
Oh my.
Dr. Tiwari still doesn't let me forget that. But anyway, so I just thought, as surgeons, we are such control freaks. We can do it all. We just don't know our limitations sometimes. And I came back and I had infection on my chest on both sides. And I don't know if the travel contributed to it or not. I would have had infection regardless. I don't know, but I had to go in for emergent surgery to have the tissue expanders taken out. So bacterial infection on both sides.
Wow.
So yeah, and then I also developed some abscesses on my chest wall. So I really didn't have anything. I was flat for about a year. I wore bra prosthesis. So when I talk to women about different options, I talk about all this. And being flat and wearing prosthesis, I did have loose skin just from the, mastectomies. I had nipple sparing mastectomy, and the prosthetics did not fit very good because of the loose skin. And women will say sometimes who opt for flat closure, what if this person or that person is looking at me? Honestly, no one is looking at you. People are busy looking at themselves. Like sometimes 80% of us women have issues with body image, and that did play a role in my life at that time. Now, if I were to choose it now, I would probably choose no reconstruction, only because I think I'm just much more confident in my own skin. I'm older, so back then, so I didn't have anything. I wore prosthesis for a year. And then a year later, I didn't want to go back to getting tissue expanders, only because I was afraid of infection again. So that's when I had the deep reconstruction. So it was a year after my mastectomy. So
Yes,
yeah.
a lot of similarities there. I had delayed also. I never had expanders, but I had had prior radiation to my left
Oh,
breast.
oh, I see.
Yeah,
Okay.
yeah. And but yes, the I think the mental trauma that we go through losing a body part, and
Yeah.
then just the feeling of the prosthesis. I wore the silicone prosthesis in the hot summer of Arizona. I just still remember that, but yes.
Yeah.
So
Yeah.
similar story. Um, so what do studies tell us, Dr. Halaharvi? We're talking about, healthy lifestyle and so forth, uh, after a diagnosis, while you're in recovery. What do studies tell us about lifestyle factors on survivorship?
Yeah. So there are lifestyle factors play a big role. So I am 8 years out. So some things that are important to me, and it's the same things that I tell my patients, is exercise. Exercise is
Yes.
probably number one thing that is important for patients. Studies have shown it decreases the risk of cancer coming back from 25 to 40%. And that's like taking tamoxifen or aromatase inhibitor, which is the anti-estrogen medication for those women who have hormone receptor positive breast cancer. That's about the same. It decreases by 50% recurrence. So it's very similar to that. And the side effects of exercising, you feel great. You get I could be dead tired and I make myself go work out. I come back happy and joyful, and I love lifting weights. That's my thing. Is I do boxing, martial arts, and then I lift weights. 3 to 4 times a week. So the physical exercise aspect of that, I do want to live what I teach.
That's what I like when I look at your when I look at your social media accounts. That's what's inspiring to me, is that, you are living by example.
Yeah,
There's a lot of women that deal with side effects of aromatase inhibitors and tamoxifen. So how does all that exercise or any other treatments that, because I shudder a little bit when I hear women say, well, I'm just going to stop taking it. And sometimes they do that without counsel from their breast surgeon or their oncologist. What are some of these lifestyle changes that can and have proven to help with that?
yeah. So there's a number of things with depending on what side effects women are having with tamoxifen and aromatase inhibitors, hot flashes, night sweats, joint pains. There's a number of medications one can take for hot flashes, and of course you want to talk to your doctor. So like Neurontin is a great drug. I actually take over the counter magnesium. You can take vitamin E. Acupuncture has been well studied. Clonidine is another medication that's been well studied for hot flashes. So there's a number of things women can do before throwing in the towel.
Mhm.
And I really felt exercising really helped. So I took tamoxifen for several years. And so exercising really helped my mood, because I knew when I was getting to be this mean person, you just feel like you're becoming mean, but you can't control this person. My husband can explain it better than I can. But I knew, like, when I would look at him, okay, he's getting annoyed with me, I need to go work out. And then I would work out and would feel great. And I do think these side effects did get better. Now, exercise, you don't have to run a marathon, you don't have to do anything too big. 10 minutes at a time, 20 minutes at a time. American Cancer Society really doesn't only recommends like 30 minutes a day, 5 days a week, which, going for a walk, a jog, getting on the treadmill or an elliptical or doing some sort of exercise. YouTube is full of free exercises, whether it's cardio, strength training, stretching, things like that. There's a huge power to that. And I will post, videos on social media. I look like I'm being electrocuted. My hair is everywhere, but I'm like working out. And I post those videos because I want people to see you don't have to look pretty when you're working out. It's okay because it's affecting your whole body and it's decreasing the risk of cancer coming back. And the impact it has on your mood, then it's like a ripple effect. You go back to your home and then you're nicer, you're treating your family nicer, and so there's so many benefits to that. And fear of recurrence is a big thing amongst us survivors. I live
Yes.
with that myself, just like anybody else. I had 6 weeks ago, I had like severe back pain, and it was so terrible at night. I couldn't sleep. And talked to my oncologist. At first, I thought, oh, I sprained it. And then I talked to my oncologist. She ordered an emergent MRI, and it turned out I had a slight fracture in one of my vertebrae. It's called Schmorl's node, where the disc herniates into it. And that only happens in teenagers. I guess maybe I'm reverting in age and becoming a teenager. I don't know.
I love that. I love
I know that's
I
kind of
love
how I
that.
sense
Yeah.
it. I do think what it is the barbell that I was lifting with not good proper form may have contributed to it. I'm 100% fine now with the physical therapy and following the instructions by my sports medicine doctor. But it's really important to exercise. I can't emphasize enough the positive benefits of exercising, including decreased fear of recurrence for those people, and in general, overall quality of life benefits.
Yeah. Yeah. I think too, what it does for me, what exercise does for me, it helps me kind of gain confidence in my body, because I think sometimes you were addressing the blame game earlier. Did I have, one too many tequila shots, or you know, did I all these things that go through our head. Did I eat too much of this, or did I not do too much of that? What exercise does for me, Dr. Halaharvi, is it kind of gives me back that confidence that my body didn't betray me. I can still do these things, and it still is capable of doing these things. And I really like the fact that you emphasize too that we don't have to go run a marathon.
Right.
Our bodies are physical structures that are meant to move. They're not meant to sit still. And so that's why I'm glad that surgeons encourage patients to get up very soon after they have surgery, even
Yeah.
just to get those bodies moving again.
Yeah. Also, one other thing I'll say is there are times I do have trouble sleeping at times, and I can always trace it back to not having exercise regularly for that week or that day. And so it helps me sleep. And also, anytime I have anxiety, depression, I always feel like that is like a great medication for that as well. So there's really no downside to it. Now, I will say, I was raised in a household where my mom put everyone ahead of her. And for me to come home after working 12, 14 hours a day to telling my husband, honey, I need to go work out. And he's super understanding, of course, but that took a little bit of adjusting to that. Like, I haven't seen him for all these hours, and I'm coming home and I'm like going out to work out, and he's very understanding. But I think we women need to be okay with that. If we exercise and take care of ourselves, then we can take care of everyone around us, including our spouses and kids. And I think somehow in our generation that hasn't been, like, we didn't grow up with that sort of mentality. We saw our moms who like took care of everyone. We just thought that's the thing you do, as a woman. But
Mhm.
and I tell that to women too. It's you're not being selfish. In fact, you're being selfless to take care of yourself.
Yes, that is some
So,
really good advice. Okay,
yeah.
so I also hear you like to dance.
Yes. I wouldn't call myself a great dancer, but I do like to dance. So I love dancing. Dancing is supposed to be like, it is an exercise. It really uses different parts of your brain. I do believe in building neuroplasticity, this connecting these neurons as we get older, trying different things. I also was learning piano, virtual piano, actually. So I started this fundraising event called Dancing with Survivors. So Fred Astaire, they team us. They take survivors, they train us a 2-minute routine, and then we have this beautiful black tie event where there's like this dances and lots of food and drinks and like lots of fun stuff. But we raise money for a good event, and this year we are raising money for Pink Ribbon Good. So, and
Uh,
I have 7 other survivors who are doing this, and it's very beautiful. You get to know other people, you learn a new routine, you just become confident, and it's all about that, having that growth mindset, going outside your comfort zone and learning something new.
yes.
I think it built a lot of confidence. So
Yes, yes, I saw that too on social media, so I had to throw that in the mix. Thank you
yeah.
so much for joining me today. This has just been so enlightening. Shining this light on survivorship, I think, is important because so many of us now have moved on beyond a breast cancer diagnosis, and you are a shining example of that.
Thank you so much for having me. And yes, and taking care of my patients, taking them from that scared person when they're first told that they have cancer to this survivor, warrior, and thriver. That's really what gives me joy. And 80% of the breast cancer survivors come back and say their life is way better now than it was before. Everything that they do is more meaningful, purposeful, and I don't know why we have to go through these things in life to have that sort of enlightenment, but I love that. I love seeing that transformation, if you will.
Yeah, I feel that same way. And I don't know, call it a bang up side of the head or whatever, but I am grateful every day that I'm here. I'm grateful every day my feet hit the ground. I
Yes.
know that breast cancer, having it twice for me, was a large part of that transformation. And so for you to be that survivor, but also to be that breast surgeon for so many women, and to see that firsthand every day, the beauty of survivorship, and that's just a full circle for you, really. So thanks
Yeah.
again for joining us. Really good to see you. And finally, my guilt is relieved, Dr. Halaharvi. Your patient, I have to tell them now that, yes, we got you on the podcast. So I'm anxious to get this one out and get the information and inspiration out to the listeners. Thanks again.
Thank you so much, Terry. I really appreciate it. Thank you for having me. This means a lot.
You're
Such a
very,
privilege. So thank you.
you're very welcome.